Good morning. Thank you all for being here today. I have a little bit of allergies, bear with me. The Camden County Prosecutor's Office is very grateful to be able to partner with our Camden County Commissioners, our Camden County Chiefs of Police Association, Cooper University Healthcare, and Virtua Health to launch the Blue Envelope program in Camden County. With me today to introduce this initiative is Director Cappelli of the Camden County Commissioners, Gloucester Township Police Chief David Harkins, who is also the President of the Police Chiefs Association, Cooper University Healthcare CMO, Dr. Joseph Montella, and Virtua Healthcare Director of Operations, Greg Pease. And we have special guests, Bill and Gloria Jensen, founders of Luke's Place, a nonprofit organization serving our adult special needs community, and other guests who will be speaking as well. We have Patty and John Senderowitz and their son John, and Eileen and Ray Schillinger and their son Alec. So the timing of this initiative couldn't be better. As you may know, today is the first day marking Autism Awareness Month, which recognizes and celebrates our autistic community. In New Jersey, autism prevention in children is reported to be about 1 in 35 children. In our densely populated state, that means a significant portion of our community is dealing with autism or a similar situation. For law enforcement to be successful, we need to build the best possible relationships with everyone in our community. This includes neurodivergent individuals. What I love about the Blue Envelope program is that it's simple yet effective, no fancy technology or complicated procedures. The name says it all. So this is our Blue Envelope. These Blue Envelopes will definitely help reduce stress and anxiety for autistic individuals during traffic stops. By alerting officers to their condition, it cuts out all the guesswork. We need to keep in mind that officers have no idea who's behind the wheel and what the challenges that person is facing. So once handed the Blue Envelope, officers will be able to handle these encounters with greater compassion and understanding. The envelope has information printed on both sides. The front explains to the driver what to expect in an encounter with law enforcement. For example, keep your hands on the steering wheel. Alerting the driver, the officer may use flashing lights or may shine a flashlight into their car, or may wear a noisy radio or a recording device like a body-worn camera. When asked for documents, now the driver knows to simply hand over their envelope, which will have their license, registration, insurance card, and emergency contact information in it. The back advises the police officer on what to consider during these encounters. The driver may be extra sensitive to light and loud noises. The driver may fidget or not be able to make or maintain eye contact. And when speaking to the driver, the officer will know to speak clearly and give simple explanations, giving the driver extra time to respond. With all of the driver's important documents in one place, the need to frantically look through the glove box is eliminated. Officers may also learn that more about a driver's disability and their emergency contacts if that person is registered with the Public Safety Alliance for Individuals with Disabilities, also known as the AID program. The AID program is a national voluntary service open to anyone in need. So we've designed these informational brochures with 2 QR codes, one explaining the AID program, the other explaining the Blue Envelope program. These brochures can be found at any of our partnering agencies as well as on our website. As a mother, I'm confident the Blue Envelope program will come as a relief to the parents of autistic teens and young adults who are new drivers. Watching a teen or young adult learn to drive is a harrowing enough experience for parents. Hopefully, this will bring comfort to those who know their child will have a way to quickly explain what they're experiencing during a stressful encounter. Everyone wants to be there for their children, but the reality is children grow up and we can't be everywhere all the time. Unfortunately, we've seen cases arise in the news involving a neurodivergent person who is alone and has a negative encounter with law enforcement. Almost always this is because the police officer didn't understand the reasons behind that person's behavior. We can and have to do better. Moving forward, Positive and productive encounters between autistic drivers and the police will start with this simple blue envelope. Again, I thank you all for coming, and this time I'd like to introduce Director Lou Cappelli.
Thank you, Prosecutor. And I first want to thank Prosecutor MacAulay for her leadership in implementing this program. You've done a great job, and it's as you've heard, it's a really outstanding program that will be very beneficial to everyone in Camden County, law enforcement and drivers as well. And I do want to also thank our law enforcement community, because I think we have the most compassionate law enforcement community in the state here in Camden County. Whether it's opioid addiction, this particular issue, and others, our law enforcement personnel in this county always step forward to be compassionate, reasonable, and to look out for those who really need help in our community. So I do want to thank the entire law enforcement community. And our sponsors, Cooper and Virtua, thank you so much. Always a big part of what we do. There's a couple of representatives. I see Lou Bezich here from Cooper. Was Court here? There he is. There's Court from Virtua. So thank you both for your participation. The Blue Envelope Program is a simple, practical way to improve communication between law enforcement and individuals with autism or communication challenges, ensuring safer and smoother interaction during stops. For individuals on the autism spectrum, a routine traffic stop can be stressful and overwhelming. In fact, it's stressful and overwhelming for most people. Imagine if you are on the autism spectrum, how difficult this could be. This program provides them with a blue envelope to hold their important documents, signaling to officers that they may communicate differently and may need extra patience and clear communication. This small but meaningful step allows officers to adjust their approach, reducing stress for both the drivers and law enforcement while preventing misunderstandings. The program is cost-effective, simple to implement, and beneficial for everyone, officers, drivers, and families alike. It aligns with Camden County's commitment to inclusivity and public safety, and is part of our broader effort and commitment to inclusivity and public safety throughout our county. We want everybody treated with dignity and respect, and this Blue Envelope Program is a big step in that direction. So, Prosecutor, once again, thank you. Thank you to law enforcement and everybody who has made this a reality in Camden County.
Good morning, everyone. My name is Chief Dave Harkins. I'm the Chief of Police at Gloucester Township Police Department, but I'm also the President of the Camden County Chiefs of Police Association this year, and I'm honored to be representing all of them that are here joining us. But I'm really honored to be with all of you guys today, right? Because Luke's place that's here. Because this is why we're doing this. You guys are a great reminder to us why we do what we did. And as the director had just said, we get it for police, right? For everybody, it's a stressful situation to have happen when you see those red lights in the back mirror or you're involved in some kind of crash, right? It's stressful for us, stressful for anybody, but it's really especially stressful for those who may not understand all that's going on. No fault of their own. Law enforcement, we have made such great strides here, as has already been said, about what we're doing to better integrate, better serve our special needs community here in Camden County in all special way. And I appreciate the words the director said, because we do take it to heart to try to do better, as the prosecutor said. So what we've learned is that better communication leads to better outcomes in everything that we do in law enforcement. The more information that an officer has, the better the communication. The presentation of that blue envelope to the officers, whether it's a crash or a car stop, is an instant form of communication. It tells our officers that we're dealing with someone with a neurodiversity issue. That makes the encounter safer for not only the driver or the occupants, but also for the officers, because we're trying to train our officers how to better deal with these situations. So I just want to conclude with saying I'm the father of a special needs son, 24 years old. I'm honored to be with all of you as I speak with you all here. We all run in the same circles, and it's because of the things that you guys do advocating for as a parent I appreciate. And I appreciate what the prosecutor MacAulay's doing and what the director and our partners at Cooper and Virtua are doing to make sure that we do that. We get to do better as police and recognize each other's strengths, right? So on behalf of the Camden County Police Chiefs Association, I'm very honored to be here to support and help implement this program for our police officers here in Camden County. And with that, I'd like to introduce Cooper University Health Care System's Dr. Joseph Montella. Thank you.
Thank you. Good morning. It's really an honor to be here with Prosecutor MacAulay, Commissioner Cappelli, Chief Harkins, and my colleague Greg Pease from Virtua. We're really very happy to support the rollout of the Blue Envelope Initiative. And I really want to call out the powerful voices of Bill and Gloria Jensen from Luke's Place, as well as the Senderowitz and Schillinger families, for sharing your experience, and you as well, Chief Harkins. Thank you for sharing that about that. So at Cooper, we're very familiar with the needs of people with autism and other neurodiverse conditions. We have a program that actually addresses this through a 5-pillar approach. The first one is we have specialized care coordination that employs a nurse navigator to work with a multidisciplinary team to actually guide the care of these patients. The second is that we have comprehensive staff education, and this includes not only our clinical staff, but also our non-clinical staff, so that anybody who comes in knows exactly the needs of the people that they're seeing. The third is that we have electronic health record modifications so that we have alerts, we have special forms, so people know exactly what to ask our patients with special needs and address their specific concerns. We also have sensory units that we have. We have a multi-sensory unit as well as mobile sensory devices to help calm people throughout their visit. And then finally, probably most important, we have our Patient and Family Advisory Council, where we have parents and caregivers of our patients with autism and neurodiverse conditions that we constantly reach out to in order to get their feedback on how we can do better, because the whole idea is continuous improvement to make their lives better. So I think the chief mentioned it very succinctly when he said that in communication and identification are important in law enforcement. It's also important in healthcare, that we know that people get better outcomes when they can know what information they're getting and when they can communicate. And Commissioner Cappelli, I think, really summed it up very well when he said if somebody gets stopped, anybody's going to get anxious. But multiply that by 1,000 for the people who have autism and other neurodiverse conditions. It's really, really frightening. So we really applaud the Camden County rolling out this Blue Envelope Initiative, because what it's going to do, it's going to help people who respond in a compassionate way to understand what they're dealing with, to avoid any kind of more stressful situation or escalation that doesn't need to be done. So we want to thank everybody for being here today. We really appreciate being part of this at Cooper. We're proud to promote and support programs that foster more communication among the community, improving the dignity and the lives of everybody that comes here, especially our patients with autism and neurodiverse conditions. So thank you.
Good morning, everyone. On behalf of Virtua, we're very proud and excited to partner with everyone in this room. There's a lot of familiar faces in this room, and I was on the other side working alongside with you guys out there. But I want to take this moment to really thank Chief Ferris. Chief Ferris personally gave me a call, and just the magnitude and how he explained the program really just sent sound waves about how important it is to put tools in each one's toolbox about when you have a situation that we can now navigate through that situation and have a safe outcome. As a former police officer for 25 years in this great city of Camden, I know too well the anxiety that everyone has, either from the police side of it or the driver's side of a car stop. As a police officer, I just recall all those car stops where I was so nervous. So I can imagine what that driver feels like. And that's really being transparent, how nervous that officer could be if he's not equipped with the proper tools. So this is another opportunity. This blue envelope is an opportunity to equip those officers, the healthcare. So it's not a one-size-fits-all. So it's different every time we have someone in. And if we can head that off and just have some information ahead of time to really make sure that is a safe outcome, and I think this program is what it's all about. And thank you so much for calling me, and we couldn't wait to partner with everyone here, along with the county commissioners, Cooper Hospital Chief, and everyone else on the board. So we really thank you for inviting us. And we will be piloting this opportunity in our primary care locations. But one good thing is this: today is autism. First day of Autism Awareness Month, and we have a colleague culture group that is based out of Virtua that is called Visible, and their whole model is virtual colleagues with family members that suffer from autism. And this is another group that's going to help get this message out. The whole thing is, as everyone has been talking about up here, is about communication. And the way we communicate is the way we show our love for everyone on both sides of the driver and those officers. With that, I'd like to thank you again, and thank you for coming out.
This is absolutely wonderful. We are, well, first, I'm Bill Jensen. My beautiful wife, Gloria, we represent Luke's Place. We're the founders of Luke's Place, the principals of Luke's Place, and we're just honored to be here. I got to tell you, we brought a contingency from Luke's Place here. We could have filled the room with people from Luke's Place because we love the Camden County Prosecutor's Office. We have such a great partnership and camaraderie with you people that it's just a wonderful thing. Hearing the words I've heard so far from Mr. Cappelli talking about compassion, we're on the front lines of compassion. This is what we do. We have the most wonderful, devoted people that work with us at Luke's Place, and the most devoted, wonderful parents that are involved with us at Luke's Place. This initiative is exactly what we're all about. We talk about inclusion. We talk about having a situation where there's safety involved. Here it is, folks. We plan to be advocates of this program, to put it out there to everybody we can, and to touch the lives that we can with the Luke's Place people that we deal with every day. So with that, I just want to give you kind of a mile-high view of what Luke's Place is all about. We're a nonprofit. We've been in existence since 2017, and our sole purpose is to give services to these wonderful young people, pure of heart, pure of soul, the best people you'd ever want to meet. I'm the luckiest man in the world. I've got hundreds of friends. Some are here, many back there. And they're wonderful, wonderful people. We run a wonderful day program, 3 days a week actually, and we get out into the community. It kind of sets us apart. We're community-based. We get out into the community knows us, and we know the community. I'm talking about the typical community. And when you think about what these people that we serve every day really want in their lives, they're no different than anybody else here. They want to have friends. They want to have a safe environment to kind of hang out in. They want to be liked, and dare I say, they want to be loved. And this is what we do at Luke's Place. We embrace them, and we love them, and we foster them, and we make them the very best that they can be. So we have a day program. We also run nighttime programs, dances and dinner dances, and social events to get them speaking. Reciprocal conversation is very important in autism. This is what we try to foster with our young people. We also have a very active sports program. A lot of our guys you can see are wearing gold medals, as you can see. So we just competed this past weekend in WILD with the Special Olympics of New Jersey. And our Luke's Place Lions, oh, by the way, they have a wonderful head coach, world-renowned head coach, basketball genius, me. No, that's by April Fool's joke of the day. And my wife, Gloria, also wonderful bench coach. Thank you, honey. I won't ever forget you. So we captured the gold medal. So I have my athletes here. They'll have their gold on. A proudful moment for Luke's Place. But that's what we do. We instill pride, camaraderie, fraternity, friendship. That's what we're all about. So with that, Grace, thank you for having us. We love you guys. We're always here for you. Call on us. We're right at your side. And anything you want to do. Everybody here, Mr. Cappelli, thank you. Thank you, everyone, for having us. God bless.
At this time, we have some special guests from Luke's Place that may want to say a few words. We have two families, the Senderowitz and the Schillingers. You tell me, who would like to speak? Please come up. Thank you. Hi, how are you? Where do I go? All right, back here.
Hi, my name is Patty Stendarowitz. I'm here with my husband John, my son John.
I'm Eileen Schillinger. This is my son Alec.
Okay,
Thanks
and
for having us.
behind us we have two drivers who are neurodivergent. I can only speak for John myself, but it's something I never thought he would be able to do. We took advantage of a really tough time for everybody during COVID when there was nobody out on those roads, and we just practiced, because if there's one thing this kid has always done, it's he's never seen himself any different than anybody else. So he always wanted those milestones to happen, and although we might not have thought he could do it, he's shown us again and again that he can. So he did his best and studied harder than probably everybody in this room times 10. Took that test 26 times, and on the 27th he passed. So now he's out there. And again, this initiative was probably so needed when he passed or before he passed. So we were so happy that it came about, because one of the fears, one of the worries, one of the many worries is if he ever got stopped by a cop. You know, if there was ever an emergency, would they understand what was going on with him? Because a lot would be going on with him. And he might act very different in that stressful situation. So that blue envelope and knowing it's there, it makes me feel 1,000 times better. Knowing that he knows that he can just pull that out, and it'll answer a ton of questions that the officer may have. So we appreciate it. We want to get the word out there. That's why we're here today. We wanted to take advantage of this, and we want to see it grow. So thank you.
Go ahead.
Hi, I'm Alex Schillinger, and then I just got out of work on time around 10 o'clock, and then I punched in at 6, and I punched out at 12. I was supposed to work 6 hours, Tuesday, Wednesday, and Thursday, and then not once did I drove to my old job at Amazon, and especially I was working at Amazon for only 4 years, and then over at the MVC doing my knowledge test for 5 years, and then 2 years later I already passed my permit test through 2023, and the year's 2025, and then that's all I can say. And then I passed my permit tests a couple of times, and I passed my road tests just once in Mays Landing, and then I'm a good driver, and then going to work on time, driving home, or driving to work and driving to home, and then that's all I can think of. Thank you, everybody.
Hello, guys. My name's John Zadanowitz. I'm officially a new driver here since 2 years ago in 4th of July, like July 5th, 2023. And I passed my permit test on Westover DMV like 13 times in a row, and I kept failing. I was like studying the book. And then,
we were on a first name basis with everybody in there.
Yes, we were.
and then, and now I just passed my driver's test in July 5th, 2023 in Salem. I was kind of very nervous about it, and it took me hard things to get done. And then the thing is, I drove very safety stuff. I was seeing my friend's house, going to work in time for special sports at Sub-Custodian Bank Bridge. And then I was hanging at my friend's house, going out with them, supporting all the Special Olympics, what I got. And now I feel all great and a better driver. And then looks like if I don't get stressed at anything like that, so I don't do it very often. So I just stay calm and I'm driving, and I took someone with me. So that's for myself. I stopped the red sign, stop sign, I just stay positive, calm like that too. I was like, when I first got my driver's license, I was just a little nervous about those stuff. I had the rules too for restrictions. And now I got back to the normal stuff where I could do driving stuff.
All right. Good job. I think the biggest thing is learning how to drive gives you the independence. And her whole life, we wanted to teach him independence. So being able to drive someplace, it opens up a whole world for him. And it definitely exemplifies how independent he can be, or they can be. So we're really grateful.
I just wanted to mention how welcoming and accommodating the police force and the MVC has been in all of this. It was many times you took your test.
Many times.
And we learned that every week was the key to remember everything, and I could see the mastery. That's how I knew it could happen. But everybody has been great. Everybody, the MVC in West Deptford, there had been a time you had been stopped once.
Yeah.
And he was able to communicate, and the officers seemed prepared, even without this. So with this, so much better. I'm really pleased. Thank you for having us.
I want to thank all of our magnificent speakers and partners in this wonderful initiative. We're here to answer any questions the press may have. So,
Prosecutor, is there a similar program that you know of happening elsewhere in the state?
yes. So this exact program is already happening in 5 northern New Jersey counties. And I believe because April is the first Autism Awareness Month, April 1st today, other counties are going to be implementing the same. So this, plus the aid program that I spoke about, that's mentioned in our brochure, is all part of Autism New Jersey initiatives.
Grace, how will the envelopes be distributed? Will they be places that people can go pick them up, or locations? How will that work?
Yes, absolutely. So at all our partnering agencies, there'll be blue envelopes, as well as the brochure. And we will have the same on our website. And yeah, definitely. I think part of what Camden County wants to do is also have them in any of our public entities.
Yes.
Yes? So,
I think the medical officers are really
All the
Yeah,
local police stations too are going to be participating.
Right, so hospitals, police stations. Mhm. Any other questions? Okay.
Okay, thanks so much, guys.
Thanks so much for being here.
You guys are a lot.